Let me ask you something very personal. Have you ever wondered, deep down, whether what you do in your private moments could have an effect on your health? I know this is a question that many men over 50 or 60 years old carry silently, sometimes with embarrassment, sometimes with fear. Some even hesitate to bring it up with their own doctor. But here, with me, you do not have to feel judged. Think of this as a simple and honest conversation between two friends, sitting down over a cup of tea, talking openly about something that matters. Today we are going to talk about the prostate. That small but powerful gland, and how your intimate habits might play a role in keeping it healthy. This is not about taboos or shame. It is about your life, your years ahead, and how to live them with more freedom, less worry, and hopefully with better health. The truth is, many men at your age face similar issues. Some deal with difficulty sleeping, others with low energy, frequent urination at night, or concerns about intimacy. And for many, the word prostate carries a heavy shadow because we all know someone who has faced problems with it, even cancer. That is why it is important to understand what really happens inside your body and how simple choices, sometimes very private choices, can influence your well-being. I want you to feel comfortable here. Nothing we say is too small, too silly, or too embarrassing. This is your health, and you deserve clear and honest answers. So, before we dive deeper, I want to invite you to participate. Please write a comment below and tell me about your own situation. Do you ever wonder about your prostate health? Do you struggle with sleep, energy, or intimacy? Your words will help me prepare the next video so I can respond directly to what you need most. Now, take a deep breath, relax, and let us begin this journey together. Before we can talk about how your habits affect your health, we need to meet the star of today's conversation, the prostate. I want you to picture it clearly, because once you understand what it does, many things will suddenly make sense. The prostate is a very small gland, about the size of a walnut, sitting just below your bladder. Even though it is small, its role in your life as a man is enormous. Think of it as a tiny factory whose main job is to create a special fluid. This fluid mixes with sperm from the testicles and with secretions from the seminal vesicles to form semen. It is not just any fluid. It contains zinc, citric acid, and important enzymes that keep sperm healthy and strong on their journey. Without this contribution, sperm would not survive long enough to reach their destination. The position of the prostate is also very important. It surrounds part of the urethra, the small tube that carries urine from your bladder out of your body. Because of this, when the prostate grows larger with age, it can press against that tube and make urination difficult. Many men over 50 notice that they have to wake up several times at night to go to the bathroom, or that the stream of urine is weaker than before. That is often related to the prostate. I like to compare the prostate to a busy traffic intersection. When everything flows smoothly, you barely notice it. But if there is congestion, if something grows or blocks the way, suddenly traffic jams happen and life becomes uncomfortable. Beyond urination, the prostate is deeply connected with intimacy. The contractions of the prostate during orgasm are what push semen out of the body. That means the sensations of pleasure are closely tied to this small gland. When it works well, everything feels natural. When it is inflamed or altered by surgery, that experience can change. So, although small and hidden, the prostate plays three major roles. It helps reproduction, it influences your ability to urinate comfortably, and it contributes to your sexual satisfaction. For such a tiny piece of tissue, that is a lot of responsibility. Now that we understand what the prostate is and why it matters so much, let us move on to the next step. What happens during ejaculation and why that process can be so vital for your overall health? Now that you know what the prostate is, let us talk about something many men hesitate to ask about: ejaculation. This is not just about pleasure. It is a biological process with very real effects on your body. Ejaculation happens in two main stages. The first stage is called emission. Think of it as the gathering moment. Fluids from the seminal vesicles, the testicles, and the prostate all move into the urethra, the tube that runs through the center of the prostate. At this point, everything is prepared, waiting behind the curtain, ready to come together. The second stage is expulsion. Here is where the show begins. Muscles in the pelvic floor contract strongly, nerves fire with precision, and the semen is propelled outward. This coordination is like a symphony, each part working in perfect timing. When all goes well, it creates that familiar release you know so well. But why does this matter for your health? Imagine a river. When water flows regularly, it stays fresh. But if the water is trapped, it becomes stagnant. The prostate is a little like that. When there is no release for a long time, fluids may remain inside the gland. For some men, especially those with chronic prostatitis or pelvic congestion, this can make symptoms worse. They may feel heaviness, discomfort, or even pain. Regular ejaculation, on the other hand, can act like a natural cleansing process, helping the prostate stay less congested. There is another reason this matters. Ejaculation does not only involve physical release, it also triggers the release of hormones like oxytocin and prolactin. These chemicals bring relaxation, reduce stress, and sometimes help you fall asleep more easily. That is why some men feel calm or even drowsy afterwards. It is nature's built-in stress relief. So when you think about ejaculation, do not think of it only in terms of intimacy or private pleasure. Think of it as part of your body's normal rhythm, a way to keep things moving, balanced, and healthy. It is one of the reasons why sexual activity, whether with a partner or alone, can play an important role in your overall well-being. Now that we understand the process, let us explore something even more interesting: the actual health benefits of having a regular sexual release. Now that you understand how the prostate works and how ejaculation happens, let us talk about the bigger picture. Why does it matter to your overall health if you have regular sexual release? The truth is, the benefits go far beyond intimacy. They touch many areas of your life that you may not have connected before. First, let us look at prostate comfort. Many men suffer from chronic prostatitis, which is a long-lasting inflammation of the prostate. This condition can cause pelvic pain, pressure, or discomfort. Studies have shown that when men with this problem increase the frequency of ejaculation, they often feel relief. Why? Because ejaculation helps clear out the fluids in the prostate, reducing congestion and easing inflammation. It is like giving the gland a good rinse, preventing things from getting too backed up. Second, regular ejaculation has a surprising effect on sleep. After orgasm, your body releases hormones like prolactin and oxytocin. These hormones signal to the brain that it is time to relax. That is why many people find it easier to drift into a deeper, more restful sleep afterward. In fact, a recent study published in 2023 showed that sexual activity ending in orgasm improved both how quickly people fell asleep and the quality of their rest. For men who struggle with insomnia or restless nights, this can be a natural and healthy way to reset the body. Third, ejaculation plays a role in stress relief. Daily life can bring a lot of pressure, whether it is from work, family, or health worries. Sexual release triggers endorphins, the feel-good chemicals in your brain. These help reduce anxiety, lighten your mood, and bring a sense of calm. It is not just in your head, it is your body's chemistry working in your favor. Fourth, a regular sexual rhythm is linked with higher energy levels. Some men report that after keeping an active sex life, they feel more alert, more motivated, and even stronger during the day. This may be because better sleep and lower stress naturally boost energy. When your body feels balanced, you simply perform better in all areas of life. Lastly, there is the emotional aspect. A regular sexual life, whether with a partner or through self-pleasure, can improve self-esteem and confidence. It helps you feel more connected to your body, more in tune with your natural rhythms, and less burdened by shame or silence. For many men over 50, this is an important reminder that intimacy does not end with age, it simply takes a new form. So, you see, regular ejaculation is not just about private moments. It is about your comfort, your rest, your stress levels, your energy, and even your confidence. All of these pieces add up to a healthier, fuller life. Next, let us look at one of the most fascinating questions science has asked. Can ejaculation actually lower the risk of prostate cancer? The answer might surprise you. Now let us turn to the question that many men secretly worry about. Is there really a connection between how often you ejaculate and your risk of prostate cancer? For decades, scientists have been studying this very topic, and what they have found is both fascinating and hopeful. One of the most important studies on this subject was conducted at Harvard University. In this study, researchers followed almost 32,000 men for a period of 18 years. That is a very long time and a very large number of participants, which makes the results much stronger. What did they discover? Men who reported ejaculating 21 times or more per month had up to a 33% lower risk of developing prostate cancer compared with men who ejaculated only 4 to 7 times per month. Think about that for a moment. That is not a small difference. A 1/3 reduction in risk is significant, especially for a disease as common as prostate cancer. And here is another key point. It did not matter how the ejaculation occurred. Whether through intimacy with a partner or through masturbation, the protective effect was the same. In other words, the body seems to benefit simply from the act of ejaculation itself, not from the circumstances around it. Since that Harvard study, other research groups have tried to confirm the findings. In 2017, another study supported the idea of an inverse relationship between ejaculation frequency and prostate cancer risk. Then, in 2018, a large meta-analysis, meaning a study that combined results from many different studies, again confirmed that men who ejaculated more often had a lower risk of prostate cancer. The consistency of these findings across different groups and different times makes the evidence even stronger. Of course, as a doctor, I need to be honest with you. These studies are observational. That means researchers did not force men into one group or another. Instead, they asked men to remember and report their own habits over many years. As you can imagine, memory is not always perfect. But even with that limitation, the repeated results pointing in the same direction are difficult to ignore. So, what could explain this? Why would ejaculating more often protect the prostate? Scientists have proposed several possible mechanisms, and we will talk about them in the next part. But for now, what I want you to remember is this. Having a regular sexual release appears to be associated with a meaningful reduction in prostate cancer risk. Another important reminder. This is not a prescription. The number 21 per month that you hear from the Harvard study is not a magic formula. It is an observation. It tells us that men who were more sexually active had a lower risk, but it does not mean you need to reach exactly that number. Health is never about competition. It is about balance, rhythm, and listening to your own body. For many men, hearing this information brings a sense of relief. Suddenly, what may have felt like a guilty habit or a secret is reframed as something natural, healthy, and possibly protective. That is why it is so important to talk openly about it. Silence does not help. Honest conversation does. So, science gives us a strong message. Maintaining an active sexual life is not only normal, it may also be a powerful ally in protecting your prostate. In the next section, we will explore the possible explanations what is actually happening inside the body that might make ejaculation protective against prostate cancer. So now the big question is, why? Why would ejaculating more often lower the risk of prostate cancer? Science does not have a single final answer yet, but there are several strong theories that give us clues. Let us walk through them together. The first is what researchers call the flushing hypothesis. Imagine your prostate as a sponge with small channels running through it. Over time, environmental toxins, chemicals from tobacco, or even natural waste products from the body can collect inside those channels. If those substances sit in contact with the cells of the prostate for too long, they may cause damage that eventually leads to cancer. Regular ejaculation acts like a rinse cycle. It helps clear out those fluids before they have time to cause harm. Think of it like flushing out stagnant water to keep it fresh and clean. The second theory is about hormone balance. The prostate is very sensitive to male hormones like testosterone and other androgens. When hormone levels are unbalanced, cells in the prostate can grow too quickly and in an unhealthy way. Some studies suggest that frequent ejaculation may help maintain a healthier hormonal environment inside the gland, lowering the risk of uncontrolled growth. It is like keeping the thermostat at the right temperature so things do not overheat. A third explanation involves the immune system. Sexual activity, including ejaculation, stimulates many processes in the body. Some scientists believe this stimulation activates the immune system, making it more alert and more effective. A strong immune system is our natural defense, not only against infections, but also against abnormal cells that could turn into cancer. By staying active, your body's internal army may be better at recognizing and removing dangerous cells before they become a problem. The fourth idea relates to blood flow and inflammation. During orgasm, the muscles in the pelvic area contract and release, which boosts circulation. Better blood flow means more oxygen and nutrients reach the tissues, and waste products are removed more efficiently. This process can reduce local inflammation and lower oxidative stress. Oxidative stress is a kind of internal rusting that happens as we age, and it is one of the key factors linked to cancer development. By keeping circulation strong and inflammation low, ejaculation may help the prostate stay healthier over time. What I find so fascinating is how these theories all connect. Flushing out toxins, balancing hormones, boosting the immune system, and improving circulation, they are all different pieces of the same puzzle. Together, they suggest that ejaculation is not just about release. It may actually serve as a maintenance tool for the prostate, much like regular exercise maintains the heart or lungs. Of course, we need more research to fully understand the details, but the evidence so far paints a clear picture. A sexually active life can be a natural way to support prostate health. Now that we understand the possible mechanisms, let us answer the next important question. Do you really need to hit a specific number, or is it more about finding the rhythm that works for you? At this point, you might be thinking, so, doctor, does that mean I need to make sure I ejaculate 21 times every single month? This is one of the most common questions I hear, and I want to be very clear with you. The answer is no. There is no magic number that you must reach. The Harvard study and others showed that men who ejaculated more often seemed to have lower risks, but that does not mean you need to treat this like a strict prescription. Health is not a competition, and intimacy should never feel like homework or a duty. If you try to force yourself to hit a certain number, you may only create anxiety, pressure, or frustration. And those negative feelings can do more harm than good. What really matters is finding a natural rhythm that fits your life, your body, and your relationship. For some men, that might mean being active several times a week. For others, it might be less. The key is regularity, not perfection. Think of it as keeping the river flowing. Whether the flow is strong or gentle, what matters is that it does not stay blocked. Age, health conditions, stress, medications, and even mood all play a role in your sexual rhythm. So instead of chasing a number, I encourage you to listen to your body. Ask yourself, what feels right? What feels natural? What leaves you with a sense of balance and comfort? That is the real answer, and it will be different for every man. In the next part, let us talk about what happens when medical treatment or surgery changes this rhythm, especially in men who undergo prostate operations. Now let us talk about something very important. Many men, especially as they get older, may face surgery involving the prostate. And one of the biggest worries I hear in my office is, "Doctor, what will happen to my sexual life if I go through this operation?" It is a fair question, and you deserve a clear and honest answer. There are two main types of prostate surgery, and their effects on ejaculation are very different. The first one is surgery for benign prostate enlargement, also known as benign prostatic hyperplasia, or BPH. As men age, the prostate often grows larger and presses against the urethra, making urination more difficult. Surgery is sometimes needed to remove part of the inner tissue and clear the blockage. Now, here is what usually happens after this type of surgery. Most men are still able to have orgasms and erections, but the semen does not come out the way it used to. Instead, it flows backward into the bladder. This is called retrograde ejaculation. At first, it can feel strange or even worrying because during orgasm, nothing is expelled. But I always explain to my patients that the pleasure is still there, the sensation is still real, and the semen is later passed harmlessly with urine. It does not damage the body, and it does not mean you are less of a man. It is simply a change in the direction of flow. The second surgery is more serious. Radical prostatectomy, which is usually done to treat prostate cancer. In this procedure, the prostate gland and the seminal vesicles are completely removed. That means the body no longer produces semen. After this operation, orgasms can still happen, but they are what we call dry orgasms. The sensation may still be pleasurable, but there is no fluid. This type of surgery also carries risks such as urinary incontinence and erectile dysfunction because the nerves that control erections run very close to the prostate and may be affected. The good news is that with modern techniques, including robotic surgery, doctors are often able to spare these nerves and improve recovery outcomes. Many men today do much better than in the past. So if you or someone you know ever faces prostate surgery, remember this. intimacy does not end after treatment. The body may change, but pleasure, connection, and closeness are still possible. With guidance, patience, and sometimes medical support, many men are able to adapt and continue living full, meaningful, intimate lives. In the next part, we will return to prevention, because surgery is not something we want unless it is absolutely necessary. Let us talk about the everyday habits and medical checkups that truly protect your prostate health. After everything we have talked about ejaculation, studies, and even surgery, there is one message I want you to remember above all. The most powerful tool you have for protecting your prostate is prevention. There is no magic diet, no secret supplement, and no single number of ejaculations that guarantees safety. What really saves lives is catching problems early and living in a way that keeps your whole body strong. That begins with regular medical checkups. I know many men avoid the doctor, sometimes out of fear or discomfort, but your yearly visit to the urologist is one of the most important steps you can take. A simple blood test to measure your prostate-specific antigen, or PSA, along with a rectal exam when recommended, can reveal changes long before you feel symptoms. When prostate cancer is found early, treatment is much more effective. Waiting until problems appear is often waiting too long. Along with medical care, lifestyle plays a huge role. Do not underestimate it. Smoking is one of the worst enemies of prostate health, and quitting brings benefits almost immediately. Maintaining a healthy weight lowers inflammation and reduces risks not only for prostate disease but also for heart disease and diabetes. Eating a diet rich in vegetables, fruits, and whole foods while limiting processed products gives your body the nutrients it needs to fight disease. And let us not forget movement. Sitting all day is one of the greatest dangers of modern life. Regular physical activity improves circulation, lowers stress, and supports both hormonal balance and immune function. It is also important to be cautious about false promises. The internet is full of products and people claiming to have miracle cures for the prostate. But the truth is, health is too important to gamble on quick fixes. What really works is simple, proven, and consistent. Regular checkups, balanced diet, exercise, and a healthy lifestyle. So yes, keeping a regular sexual rhythm may support your prostate, but it is only one piece of the puzzle. Prevention is the bigger picture. By taking care of yourself today, you are giving your future self more years of energy, intimacy, and peace of mind. Now, as we close this conversation, let us bring everything together and leave you with a clear call to action. We have walked together through a very personal but very important topic. We talked about what the prostate is, why it matters, and how ejaculation is more than just a private act. We explored the studies showing that regular ejaculation may reduce the risk of prostate cancer, and we looked at the possible reasons why this could be true. We also spoke about surgery, lifestyle, and most importantly, prevention. Here is the truth I want you to carry with you. There is no magic formula, no miracle cure, and no perfect number, but there are clear steps that can protect your health. Regular sexual release may be one of them, but the foundation will always be prevention. That means going to your doctor, getting your PSA checked, doing your yearly exams, keeping a healthy weight, eating more vegetables, moving your body, and never letting fear or shame keep you silent. Your prostate is small, but its impact on your life is huge. By taking care of it, you are not only protecting yourself from disease, you are also protecting your energy, your sleep, your intimacy, and your confidence. That is worth every effort. Before we finish, I want to invite you to take part in this conversation. Please leave a comment below and tell me what you think. Have you ever worried about your prostate health? Do you believe there is a normal number for ejaculation, or do you think it is personal for each man? Your perspective matters, and I would love to hear from you. And finally, if this video has been useful to you, please show your support. Press the like button, share this video with a friend or family member, and subscribe to the channel. If you found value here, press the number 1 in the comments. If not, simply write the number 0. Your feedback guides me and helps me continue creating content that truly serves you. Take control of your health, my friend. Until next time, stay strong and stay well.